To begin your SEM session, fill the DP cold trap and the cold finger dewar with liquid nitrogen. Using the instructions manual, check for risk assessment updates and that you've signed off on these. Follow the instrument manual carefully. Check the FE operation unit. If the flash normal and flash strong lamps are lit, seek assistance from CMM staff. Slowly pull the sample holder out of the goniometer. Rotate the sample holder anti-clockwise by 90 degrees. Slowly pull the sample holder out of the microscope. Do not handle the sample holder with your bare hands. Use fine forceps to place a new specimen stub into the end of the sample holder. Use fine forceps to push the metal release tab. The serrated metal clasp should jump forward, locking the specimen stub into place. Turn the sample holder upside down. Using a gloved finger, tap gently on the sample holder to ensure that the specimen is secure in the holder. Carefully slide the sample holder into the goniometer until the sample holder comes to a stop. The key should have just gone into the keyway and no longer be visible. Push the sample holder in about 2 millimeters. The red evac light will turn on. After about 30 seconds, the red evac light will go out. Slowly rotate the sample holder clockwise by 90 degrees until a stop is reached. Keeping a firm grip on the sample holder, slowly allow the specimen holder to be pulled in by the vacuum within the microscope. With the accelerating voltage turned off, adjust the accelerating voltage, then turn on the accelerating voltage. Position the secondary electron detector for the kV you require. Open valve V7, use coarse focus, then fine focus to get the best possible image of the specimen. Release the goniometer motor. While tilting the goniometer back and forth, rotate the specimen height control knob. Adjust the goniometer back to 0 degrees tilt. Reapply the goniometer motor. Bring a noticeable feature of your specimen onto the crosshairs. Increase the probe current within the selected range. Bring the feature back onto the crosshairs by using the gun alignment XY shift knobs. Continue this until no image shift occurs. Adjust the gun alignment XY tilt knobs for the brightest image. Increase the magnification and continue to adjust the gun alignment XY tilt knobs. Select ECP from the EOS mode area. Rack the ECP focus back and forth using fast movements, while adjusting the objective aperture alignment knobs on the column until image movement is reduced to a minimum. Only small adjustment of the knobs are required. Do not turn or adjust the small handle below the aperture knobs. Focus on a noticeable feature of your specimen. Press the wobbler button and adjust the amplitude so the image movement can be easily seen. Adjust CL alignment XY tilt knobs so that the image converges and diverges from the center of the screen but does not translate across the screen. Turn the wobbler button off. Center a noticeable feature and focus. We shall call the center of the screen point O. Press objective pole button, apply lens clear for 1 second. The feature which was at point O is now at point A. Mark point A with a whiteboard marker. Recenter the feature at point O with the specimen translators. Press objective pole button, apply lens clear for 1 second. The feature which was at point O is now at point B. Mark point B using a whiteboard marker. Use the specimen translators to move the feature to the point where the perpendicular bisector of OA intersects the perpendicular bisector of OB. Use the CL alignment XY shift knobs to return the feature to the center of the screen. Step up the magnification and repeat these steps. A good idea is to double the mag each time you repeat the alignment. and finish at a maximum magnification of about 25,000 times. This step is completed when points A or B move less than 1 micron from point O. Recheck the wobbler and use the CL tilt knobs to adjust if necessary. Focus the image as best you can. Adjust the XY stigmators for the best image. Press the accelerating voltage button off. Make sure that the valve V7 is closed. Slowly pull the sample holder out of the goniometer. It will reach a stop at about 10 centimeters. Rotate the sample holder anti-clockwise by 90 degrees. It will reach a stop. Slowly pull the sample holder out of the microscope. Using metal forceps, drag the serrated metal clasp towards the O-ring side of the sample holder. You will hear a click. Use fine forceps to remove the specimen stub. Carefully slide the sample holder into the goniometer until the sample holder comes to a stop. The key should have just gone into the keyway and no longer be visible. Push the sample holder in about 2 millimeters. The red evac light will turn on. After 30 seconds, it will go out. Slowly rotate the sample holder clockwise by 90 degrees until a stop is reached, keeping a firm grip on the sample holder. Do not allow the sample holder to be pulled in by the microscope vacuum. At the completion of your SEM session, leave your magnification greater than 100,000 times. Turn down screen contrast and brightness, fully anti-clockwise.